In this clinical teaching guide, we will focus on the SNAPPS model for outpatient education. The outpatient teaching setting presents several challenges, such as time restraints, schedule blocks, and the pressure of having to cut out time in a busy physician schedule to teach. Fortunately, there's a teaching model for that. SNAPPS is a learner-centered model for case presentations to preceptors in the outpatient setting. Using the SNAPPS model, the learner will summarize the history and findings, narrow the differential to 2 or 3 possibilities, analyze the differential through comparing and contrasting, probe the preceptor with questions about uncertainties or alternatives, plan management for the patient, and select a related case issue to continue their learning. To summarize, the learner will give a brief history of the patient and any pertinent medical information. The length of the summary depends on the preceptor's preference. Remember to be patient with your student when they give their first summary, and make sure to give them feedback. Finally, encourage your student to present their cases at an increasingly higher level. The student will then narrow the differential down. There should be no guessing here, only thoughtful answers. 2 or 3 diagnostic possibilities are expected for new patients, while follow-up diagnoses are expected for follow-up patients. The student must first present an initial differential to the preceptor in order to engage in revision and expansion. Remember that zebras, or rare conditions, will most likely be at the forefront of the student's mind. The student will then analyze the differential by comparing and contrasting the possibilities. This allows the student to verbalize their thinking process and simulate an active discussion with the preceptor. Next, the student will probe the preceptor about uncertainties, difficulties, or alternative approaches. This will allow the student to clarify any confusion or knowledge deficits they may have. Questioning the preceptor gives the student an active role in their learning. Next, the student will plan management for the patient's medical issues. This will be initiated through discussion with their preceptor. Finally, the student will select a case-related issue to continue their own learning. Be sure to encourage your student to be consistent in reading daily rather than reading in long, unfocused bursts. Published data has revealed positive student feedback as a result of applying the SNAPPS model. The studies have found that students feel more capable in assuming an active role during the rotation, and that they appreciate the unique communication approach between themselves and the preceptor.
This video is produced by the Office of Faculty Affairs and Development at the Burnett School of Medicine. Thank you for watching.